Good afternoon and welcome to today's session. This is part of our virtual learning series for in honor and recognition of victims and survivors of Crime Week. I'm thrilled today to be highlighting gender-based violence among older adults, supportive interventions. We're going to be looking at the AIM study today, supporting women in midlife and older who experience intimate partner violence. Before we begin, there's a few housekeeping slides that I want to touch on today. So we'll begin with a land acknowledgement. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land throughout the ages. We seek a new relationship with the original peoples of this land, one that is honored in deep respect. So just a few housekeeping slides. Since this is a live provincial webinar, all attendees today, your microphones will be muted, but I do encourage everyone to post any of your questions in the Q&A box. And then as well, within the chat box, please post where you're joining from. We always love to see where attendees are joining from across Canada or within Ontario. But please do keep your questions to the Q&A box. It makes my work easier when we get to ask Dr. Weeks questions at the end of the webinar. It makes it much more streamlined to be able to answer the questions that you may have. And today, as all of our webinars, we are always thrilled to be able to offer ASL interpretive services for all of our sessions. So if you require these services, you can slide the top of your screen to make either the presentation bigger or slide the opposite way to make the video larger of our ASL interpreters. We also do have closed captioning available. You'll notice on your bar in the Zoom, you can choose to either enable or disable the closed captioning for today's session. And of course, like all of our webinars, we want this accessible for all of you. We know many of you may have signed up, but can't stay for the whole webinar. So within a couple days, our webinar and the slide presentation, any resource discussed will be offered on our website. And we do need to evaluate all of the offerings we provide our attendees. So we do truly appreciate if you just take mere moments after the webinar, an evaluation link will pop up. This really means a lot to us. And this is where we truly are able to ensure that we're offering webinars that you as an attendee find useful and beneficial for the work that you're doing. We need to be mindful of respecting everyone's confidentiality and your right to privacy. So we appreciate that in many of our webinars, there's certainly personal circumstances that attendees may want to address. I want to encourage you to reach out to our head office. You can request a consultation, but please keep private information away from the chat box. And for those of you that are not aware of our organization, we have a very simple vision. Elder Abuse Prevention Ontario, we envision a whole Ontario where all seniors are free from ageism and abuse, where human rights are advanced, protected, as well as respected. And we are mandated to support the implementation of the provincial government strategy to combat elder abuse. And year after year, we are generously funded under the Ministry of Seniors and Accessibility. So without further ado, I am absolutely thrilled to be able to present to you Dr. Lori Weeks. Dr. Lori Weeks is a professor at the School of Nursing at Dalhousie University in Halifax, where she also holds a cross appointment in gender and women's studies. Her research focuses on the need of vulnerable older adults in a variety of settings, where she has particular interest in the supports for women in midlife and older experiencing intimate partner violence. Today, Dr. Lori Weeks will provide an overview of current knowledge about the needs of women in older life and older, and midlife and older, who experience intimate partner violence. She will share information about the development as well as the implementation of the AIM study, including the context of the AIM program developed to support women in midlife and older, and training community-based researchers to develop and deliver the AIM program. So without further ado, I'm thrilled to pass over the slide presentation to Lori. I'm just going to stop my share here. There we go. And over to you, Dr. Weeks.
Okay, thank you very much for the invitation to attend and present at your webinar today. When I switch to my view, I can't see the people anymore, so please do let me know if there's anything that I need to attend to that I'm not able to see at the moment here. There we go. So I will try to endeavor to speak slowly. We are fortunate to have ASL interpretation today, so I will try not to be too wordy and to speak as slowly and clearly as I can and take some pauses at times, especially in between slides. Well, thank you very much for this invitation to present today. And it's lovely to see so many people, and I know that many will be able to access the recording of this presentation as well. So Laura has already done some acknowledgements. I just wanted to point out, I won't read I will sometimes have way more text on my slides than I will actually read, but it will be there for your information later if you wish to access it. So I'm joining you from the Maritime Provinces in Eastern Canada. Dalhousie University is located in Mi'kma'ki, which is the ancestral and unceded territory of the Mi'kmaq. We also, in our region, often acknowledge the African Nova Scotian community, who are a distinct people in Nova Scotia and have been in the province contributing to our community for over 400 years. And I don't usually read all of the official acknowledgements, but to me, as a person who is from settler origin, what this means to me is basically an ongoing process of learning and engaging with a wide variety of people in the community and in my research, and providing support and assistance wherever I can to students and colleagues who come from groups that have experienced a great amount of discrimination in the past, and trying to rectify those things in the work that I do. I'd like to acknowledge our research team. So we have many others who are engaged in this work. I am one of the PIs and the lead PI of this research, but it takes many people to do this work. My co-lead is Kathy Holtman, who's at the Mural McQueen. Now, this is a mouthful for ASL. It's a family violence research center at the University of New Brunswick. That might be the easiest way to say that. So I have many colleagues in the province of New Brunswick, also in Nova Scotia and Prince Edward Island. This is an initiative in the Maritime Provinces. We also have many partners and collaborators who work in various governmental organizations and non-governmental organizations in the Maritime region as well. So we have a relatively large research team supporting various aspects of this work. So today, as Laura mentioned, I will first provide some context about older women and intimate partner violence, and then introduce to you the AIM program and the research evaluation project that we are doing. Also, the facilitator training that we have implemented to be able to conduct this work, which is a very much a community-based research and very engaged with many organizations that support um, intimate partner violence and domestic violence in various ways in the community. So first, I will talk briefly about older women and intimate partner violence and some of the context and things that have led up to the current work that we're doing. I have been engaged in work in this area for a long time, early on in my academic career. So I first began working as a faculty member in 2001. And early on, I became engaged in a study that colleagues had been doing around elder abuse and working, collecting data from professionals who worked in a wide variety of areas and asking them questions about their detection of elder abuse, the types of elder abuse um, that they experienced in various types of practice as a professional. And from there, we did a sex and gender-based analysis of that information and learned a lot about um, of sex, about the people who were perpetrating violence and the recipients of violence within the context of an elder abuse research study. And at that time, that was quite unusual. There hadn't been a whole lot of discussion around sex or gender around elder abuse. And that really kind of led me on a journey of trying to bring together the worlds of domestic violence or family violence and elder abuse. I think the invitation to present at this webinar today with Elder Abuse Prevention Ontario is a good example of how both organizations focused on elder abuse are also interested in sex and gender-based violence and family violence, and also organizations focused on domestic violence are starting to have an interest in the needs of older people who use their services. However, I still find that there does tend to be less evidence, less emphasis, less research, less services devoted specifically to the needs of older adults who experience abuse compared to younger people. And that is still continues today. There does still continue to be some issues around ageism in domestic violence or family violence research and services. And what I mean by that is either in less focus on the needs of older people or not even recognizing that there are different populations that use their services, different age groups, and adapting services to meet the needs of older people. I also believe that there's still some evidence of sexism in elder abuse research and services, but again, today is an example of how there's more focus in elder abuse organizations to focus on issues of sex and gender as well. But there still continues to be issues around less focus on sex and gender in elder abuse as well. So these worlds, I think, are coming closer together with the work that lots of people are doing, but I think there's still a lot of distinct differences. And it's that space between elder abuse and domestic violence that I've been working in this theme area in the research that I've been doing now for some time. In general, I do like to point out that it's often very difficult to present very clear statistics around incidence and prevalence because all forms of abuse are underreported. We don't know the full picture of what happens in terms of abuse of older women. So we also, however, feel that older women may be less likely to report abuse than younger women. And there's many barriers there for all people, but specifically for older adults. And I'll touch on some of those things in a little bit. Also, I like to point out that abuse can occur in many forms, and often a person can experience more than one form of abuse at the same period of time. For older women, these four contexts are ones that I think it is important to point out. There might be additional ones, but so far we've identified these four. An older person can be experiencing intimate partner violence in a long-term abusive relationship. And when I began in this work, That's probably the context that came first to mind. Also, in my practice with older adults, especially in residential care settings, over many years, had many conversations with older adults, older women specifically around long-term abusive relationships that they endured. So that was definitely one that, unfortunately, I encountered many times in practice with older adults in care settings. There also could be a situation of abuse occurring in a new relationship that began in later life, which is quite a different scenario than number one. A woman also could be experiencing abuse that throughout many different relationships over time. And number four is also very interesting, which is the one that we've probably identified more recently, a long-term relationship that became abusive over time. And this could be because of various potential changes in health status, especially cognitive status or dementia, where a person who was not abusive earlier could become abusive because of some of those health challenges and changes over time. So those are just a few things to give us kind of a baseline of where I'm coming from and my understanding of older women and intimate partner violence. And I'll try to slow down. I think I'm already probably saying too many words. So I also like to point out that the work that we do is from an intersectional lens. And this is something that's probably quite familiar to many of you attending this session today, so I won't dwell on this too much. But it's really important to think about all of those different identities that can have an impact on a person's experiences of violence. So on the next slide, I have an example of an image. I've presented in my teaching and various other research presentations models of intersectionality, but this is the one that I think I like the best. I've not seen a better way to try to explain the concepts of intersectionality clearly. And this is actually a diagram created by the Ontario Association of Interval and Transition Houses. Now, of course, not every factor is included in this particular diagram, but it has some very interesting ones. So the way this one is presented is above that line in the middle, that darker line, it is the factors that contribute to a person experiencing privilege or power in society. And then below the line, it kind of, if you follow the factors to the other side of the wheel, you can see the other extreme. So the components of those factors that can also contribute to marginality. So you can see a gender, for example, man and woman are the two extremes that are listed there. I find that it's interesting. Again, I didn't develop this model, but the age one is really interesting to me as a gerontologist focusing on research on aging in many contexts, where people who are between the ages of 18 to 40 are identified as given a position of privilege or power in society, and where on the other extreme of that, older adults are given less privilege or power in society and are marginalized. We could debate the age range that's included here, but there are a lot of the work that I'll be talking about today focuses on women in midlife and older. So it's not specifically senior citizens necessarily that we talk about in terms of this work, but a little bit older than 40. So this might be, this is just a nice representation of some of those factors that can contribute to marginality or positions of privilege or power in society. Some of you may have been seen these wheels as well. So on the left-hand side of the screen is a wheel that you might be familiar with, the wheel of power and control. It's something I've been aware of for quite a long time. It's been available, I think I first saw it probably in the mid 2000s. So it's a description of a visual description of how a person who is an abuser obtains and maintains power and control over other people or another person using various strategies that threatening the person, threatening, um, belittling them, reducing their self-esteem, and various factors, isolating them from family and friends. So various factors to make a person feel like they have less power and control in a relationship. Very interestingly, the wheel on the right-hand side was specifically developed, focused on research with older women. And a few things that I like to point out here is that essentially it's the structure of it is the same. So the concept of power and control in the middle and various strategies or ways that power and control is obtained and maintained over other people. There are a few differences. The older women are less likely to be caring for their own young children. However, they might possibly be caring for grandchildren. So there still can be issues around children that could be, threats could be made around the safety of children, for example, but it wouldn't be as likely to be the person's own dependent children at that stage of life. So there's a lot of similar factors. The dynamics of these relationships are essentially the same. There could just be slightly different ways that power and control is obtained and maintained over another person in midlife and beyond. I was told that taking a sip of water can help me to slow down a little bit, so I will try to do that after slides. So the things that we know that, sorry, I'm moving a few things around on my slides so I can see my own slides a little easier here. So, because of various life course and cultural factors, older women may have different beliefs and responses to intimate partner violence than younger women. So, these are just some summary statements, kind of general conclusions drawn across research that I've been involved in and others as well. These are just key points that really are some of the rationale for why we focus on the needs of older women in particular. So let's see, without saying all of the words on here, what can I say that might be really useful for you? Um, for older women, we have a lot of information around financial status. Often the employment, education, and employment opportunities available to older women today are much different than a lot of younger women. So that issue of finances and financial dependence or independence can vary quite a bit, and that can be a huge factor in the ability of a person to make decisions around their own safety and living with partners or not living with partners who are abusive later in life. Another one was really the third bullet here around age and cohort effects, where people who were raised a long time ago in a different climate around gender roles, around the role of women, the permanence of marriage bonds, the kind of boundaries around families, and the less likelihood of older women often to seek help and support outside of families compared to younger women. All of those factors together, because of a person's age and changes over time, especially differences when an older woman was raised, could have an impact on her experiences of violence in later life, and especially willingness to seek out supports for assistance in later life. And then the final one, there's a lot of research around religion, and we know that as a general trend, of course, there's variations, but as a general trend, older adults tend to have more stronger religious beliefs and values than younger people in our society. So that could be more of a factor for older people compared to younger people when it comes again to beliefs about seeking support and staying with a partner or not because of religious beliefs. So these are just some of the things that really can be quite distinct or give a different context related to older people versus younger people who are experiencing violence in relationships. I've in the work that we've done in a lot of these slides, I'm sharing a lot of resources that others have developed because it's always important to compile those things and not to recreate the wheel. This is a really nice video about what is violence against older women, developed by Women Act, which is the Women Abuse Council of Toronto. So this is, if you wanted further information specifically about what is violence against older women, this is a really nice tool. So I suggest you can watch that if you wish some further information specifically on violence against older women. So next, I'm going to talk to you a little bit about the development and implementation of the AIM program and the research that we're doing to evaluate this particular program. So I will say AIM for short. It's the Advocacy Intervention for Women in Midlife and Older, but AIM is a much easier acronym to say than that mouthful. It's always nice to come up with a nice acronym for a study, so you don't have to say the full thing. So I've been involved in a variety of research projects with a research group in the Maritime provinces. So ANORT is the acronym for a research group. It's the abuse, it focuses on the abuse and neglect of older adults in the Maritime provinces in Canada, or ANORT for short. So we've been engaged in many projects focused on elder abuse and intimate partner violence and older adults in particular for many years. In the summer of, or spring, I suppose, of 2022, our team was invited to submit a proposal to the Public Health Agency of Canada focused on preventing and addressing elder abuse. And the criteria specifically were to deliver and test health promotion programs and interventions designed to address elder abuse in the context of family violence. So even though the timing was really challenging, dealing with lots of issues around COVID and working at home and various members of our team had many different commitments. We were able to submit that application very quickly and submit it in the summer of 2022. And we were very grateful to be one of the teams that were selected to receive quite generous funding to do a 3-year project from the Public Health Agency of Canada. So we officially began this work in January of 2023. So we are now almost halfway through this 3-year project, the AIM project. So a little bit more about the evolution of this and maybe why our team was able to pull together our application so quickly. We did have quite a strong track record and knowledge and understanding of the body of knowledge around the topic as a whole. However, during COVID, I also was involved in leading a systematic review project. And in general, it was focused on a synthesis of interventions or programs to support women experiencing violence, not specifically older women. It would have been nice to do that, but there was limited information, so we focused on women of all ages, but specifically interventions that could be delivered in a context like COVID, where you wouldn't be able to deliver face-to-face services like before. So it became a review of basically technology-mediated interventions primarily. Things using different technologies to deliver services by distance, such as using video calls or phone calls or apps versus a lot of face-to-face service delivery. So we learned a lot doing that systematic review. And one of the interventions that was included in our review, published by Tuari and colleagues, was one that was very fascinating to me. And it's the one that we really modeled the AIM program after. So it had very, very promising results from the research that had been done on this particular intervention. So um, without that systematic review, it would have been difficult to develop an intervention to test as part of the funding from the Public Health Agency of Canada. And I'll give you more details certainly about what the program is all about. So, what some of the key aspects, though, is that it's very highly individualized and tailored, and we know that those can be very helpful. The needs, women can have very, very different needs, so that's some very important elements of it. It's also been tailored to meet the diverse needs of older women in the maritime provinces in Canada, in particular as well. So the people who we've targeted to participate in our study and receive our intervention are people who self-identify as a woman, who are in midlife and older. I have about ages 45 or older. We originally thought that it would be a little bit older than this, but as it ended up, 45 and older seemed to be the right fit for this particular intervention. Live in one of the three maritime provinces, can participate in English or French, and we have full capacity to deliver the intervention in French and do all of the data collection in French as well. We have many colleagues in New Brunswick in particular, which has a large Francophone population. So we've been very fortunate to be able to have colleagues that could support that component of the work. For this particular intervention, we're focused on older women, women in midlife and older, who are currently living with or are in the process of leaving an abusive partner. And that was a very deliberate approach. Interventions do need to be targeted to be effective. This one in particular needed to be. And in some previous work that we did, actually part of that systematic review, to be able to um, talk about different types of interventions. It was this one in particular that we felt there was great need for. There's certainly interventions focused earlier on around identifying abuse, screening for abuse, helping people understand what abusive relationships are. There's also interventions focused later, in a sense, in terms of a trajectory around people who have permanently left an abusive relationship and need different types of supports at that time. Our focus is people in the middle, people who are currently living with or in the process of leaving. In the process of leaving, referencing that it is often a process. It's often, in many cases, not a person who just decides to leave and leaves, and that's it. It doesn't happen that way, as many of you, I'm sure, know. It can be a process of many times of leaving and returning and that sort of thing. So that was important because in other research we've done, we had collected data specifically from professionals or people who had permanently left and were not currently in an abusive relationship. So we had to pay very close attention to the ethical components of doing this research and ensuring that there's protections in place for people who are participating in our research. In addition to people who are Francophone, we are doing our best to include diverse women in our study, including new immigrants, people who are visible and racialized minorities, and people who live in rural places. We're partway through our study, and the two groups, Francophone and living in rural places, are probably the easier ones for us to address in the maritime provinces in our particular context. But we also have a lot of new immigrants and visible and racialized minorities, but we've had fewer of them participate in our research so far. And very importantly, in this intervention, they can be receiving other supports, other programs, using other services as well. So we're not trying to limit people to only receiving our AIM program. They can be receiving lots of other services as well. So it's a bit about who participates. So the AIM program. So again, we modeled this after the intervention that Tawari had developed. So very importantly, we definitely were influenced by our review that was completed during COVID, we did choose to make this an entirely virtual intervention. So all aspects, training people to deliver the intervention itself, all of the data collection is entirely done in a virtual way. That can be through either video calls or telephone. And in lots of cases, it's perfectly fine to use very low levels of technology, such as the telephone. So basically, again, modeled on Tuari, the first component is an information sharing component of about an hour, where the people that we train to deliver the intervention include various components that seem to be of most interest to the person that they're delivering the intervention to. So on the following slides, I have some examples of some of the information that we provide. We provide materials as an attachment that we can send electronically or through the mail to the women so that they have basically a package of materials. So we're not having to go over all of those, but answer questions and respond to things that the women have questions about or want to raise. So information about older women and abusive relationships, awareness raising, safety planning, decision making and problem solving, and information about local resources. So as I said, I have some examples I will go through quite quickly on the slides to follow to give you some idea of some of the things that we cover and provide as handouts to the women participating. And the second component is a social support component. And I always was absolutely fascinated by this component in the doing the systematic review where we identified this particular intervention. So it's basically a weekly session of about 20 minutes per session for 12 weeks. So after that first information sharing component, the same facilitator contacts the woman again and sets up a time to meet, usually a regular time weekly, to provide again, very tailored and very individualized. We did not set out exactly what has to happen at each session. So it's not like in session 2, this is the topic, and in session 4, this is the topic. If the woman just wants to talk, that's fine. If they have specific questions about resources in their local community, that's fine. It's really whatever the needs are that are raised and whatever questions or topics that the woman wishes to discuss. So that social support component is very fascinating, and we are very interested to see what our results will be about that. So as I said, I just have some slides, and to the ASL interpreters, I'm just going to highlight a few things. This is just some examples. And again, we drew very much on a scan of what materials are available. We didn't want to recreate the wheel. This is some lovely information from Elder Abuse Ontario around warning signs that an older person is living in an unhealthy relationship. So we just, of course, referencing where we got the materials, but used a lot of resources that were already available. Again, some additional information are from Elder Abuse Ontario around red flags of abuse by a family member, spouse, or partner. This was some really nice safety planning resources developed again by Elder Abuse Ontario. So drawing on lots of Canadian resources that have been already developed. So I know I'm promoting the people who've invited me to come to the webinar, but these were really parts of our program, our AIM program that we put together. So this was a really nice safety planning tool that we've shared with all of our participants. This is also another component that we found from Women Act at the Women Abuse Council of Toronto. And it's a short information around safety planning with older women experiencing violence in particular. So it's a really nice resource. Anyone can check that out if you wish. We really felt it important to include digital safety strategies for women as they're currently experiencing an abusive relationship. People of all ages, this can be useful for them. And these materials weren't specifically developed for older people, but we wanted to make sure that the women in our study had information around computer safety and cell phone safety. So I've included the references at the bottom of the page here. And again, it can be helpful for anyone, including myself, about safety issues. things about clearing browser histories and, making sure that other people, you don't want to know what you've been doing on your devices, that they don't have that access to that information. So, yeah, so there's some really good information that you can take a look at these links. We've also compiled local community and legal resources. I've included some information on this slide from a previous study, the Respond study, that our team had led a few years ago in the pre-COVID era. And we were really interested in what kinds of initiatives are available to support older women. And we shared some of the results of this just to give people an idea of the wide variety of supports that might be available that can be really useful for them in terms of if they're experiencing abuse in a relationship and supporting them at that time. There's a lot of detail we've included because providing local supports and information about resources that are available is an important part of this program. We compiled information both on elder abuse and family violence services in the 3 maritime provinces. So this information we provided for people living in New Brunswick and then in Nova Scotia. And of course, there's a lot of similarities, but every province is different in terms of what's available. And then, of course, PEI. And we also shared some information about national resources, so things that can be provided through phone or virtually for anyone in Canada. So we shared all of those resources with our participants as well. We also, one of the other components was goal setting. So we use this very common, I believe, acronym SMART in terms of developing goals and strategies for the future. So provided this as a workshop to help women and helpful in setting goals in the future. Just some additional information and questions that we included for the women to think about. And these are some of the things that they could potentially talk about with the facilitator in the follow-up sessions, for example. So that's just some things that they can think about around setting goals for the future. So in this, this is a randomized controlled trial is the design. So I just talked a little bit about the AIM program. So half of the women who have volunteered to participate in the AIM program are randomized, so put randomly in one of two groups, those who will receive the full AIM program and our comparison group. And our comparison group basically receives a package of information and materials, handouts, if you will, electronic or a paper copy mailed to them within the information, the handouts essentially. There's no individualized support, there's no follow-ups with them. But we felt ethically it was important for those who were randomized to the comparison group to receive some information. So that was part of our ethical approval for the work. So we're testing to see the effectiveness of the AIM program, the two components of the AIM program, and to learn from the experiences of those who both implemented the program and participated in it. So we're doing a series of quantitative surveys, if you will, around things about the older women, the participants' knowledge about IPV, and to see if that changes due to participating in the program. If we're also looking at the impact on developing safety strategies, so there's quantitative assessments of that. We also have quantitative assessments of physical and mental health. So those first three are the quantitative measures. And then we're also going to be doing some interviewing of the women who participated in the full AIM program, not the comparison group, and also the facilitators who are delivering the program. And we're very interested to see what their experiences were, what their suggestions are. This is the first time this has been developed, implemented in Canada. with older women. So we're really interested to see what recommendations that they might have about the program and improvements and of the program. So we're collecting the quantitative data before the AIM program begins for both the groups, the people who receive the program and the comparison group. Then we're doing the data collection again after 3 months later, after the program is over, and then 9 months later to see if there's an ongoing impact of the AIM program. I have probably many, many slides left, but the last thing I'll probably briefly mention, um, we do want to leave some time for, for discussion at the end. I thought some of you might be interested in how we have been managing to deliver this. It's not easy to recruit this particular population, but through the Family Violence Research Center we're working with at UNB, they've learned a lot over time about community-based partnerships, and we're working very closely with service providers in the province. So we've developed partnerships with various organizations in the three maritime provinces, and there's a few different levels, and these have evolved over time. Based on different ways that organizations want to be involved with the work that we're doing. So, kind of our full partnership in Partnership One is organizations that are really eager to be involved in this work. We are able to compensate them through the generous funding that we receive from Public Health Agency of Canada. So they are involved in having their own staff who have already bring a lot of knowledge and experience around working in domestic violence. So they are trained to deliver the AIM program and facilitate the AIM program and help us recruit participants. So they're very involved, and it's quite an extensive amount of time. Um, we 30, I don't think we have a few different levels of financial compensation depending on their level of involvement. $3,500 Canadian is the minimum. That can increase depending on the number of participants that they are able to bring into the study. So I don't think we've had to go over our threshold though yet for this study. And then some organizations didn't have the capacity to be fully involved, but are helping us to spread awareness about the study and helping very much with participant recruitment. So we also are compensating them for their for their support. So people who are the facilitators, they participate in a knowledge exchange or training session with us. They are involved in recruiting women. If they're already working with these organizations, they are welcome to help to identify women who fit our study criteria and share information about the study with them. And that's been a very fruitful way to recruit participants. And also just sharing information about the study and about the program through various modes of communication, that they have newsletters and social media. And that's also been very fruitful in terms of recruitment. So the facilitators deliver the first component, the 1 hour information sharing session, and all the other, the 12-week follow-up social support components. And then if they wish to volunteer to be interviewed after a while, after they finish with those pieces, to participate in an interview so we can learn from their experiences. This is just some information. I don't think I will elaborate on just what those knowledge exchange sessions include. They've been really interesting. I've participated in all of them and along with others who are in part of our research. And the people that have been part of the facilitators that have been part of this are amazing people who have bring just a wealth of knowledge and experience in working in domestic violence, and either were already very aware of the needs of older women or very interested in how the organizations can meet the needs of older women. So just briefly, this is where we're at. So it's, as I said, we're about halfway through this whole project. So things have gotten a little extended. I think we learned very much that, we need a lot of time to develop relationships. Well, I should say the research center we work with had already had lots of relationships with various services, organizations in the community, but related to this project in particular. So, our process to train facilitators and develop relationships with organizations around this project was a little more extended than we initially expected, and honestly is still continuing. I think we're probably at the point now where we're not bringing in new organizations, but we just delivered a session with a few new facilitators in the last couple of weeks, so it was in May for sure. However, we do have an endpoint of the study, and we do need to have a stop point. So we are able to recruit new participants up until the end of June, and that's pretty much the limit. We still need to be able to deliver the intervention, which is, 13 weeks minimum, um, minimum, because we have certainly found that in some cases, it's not possible to schedule a session every week for those follow-up sessions. We've really found that over the holidays in December. So sometimes there was a slight pause and then continuing on after a little while. So it can take longer than 13 weeks to deliver that. We need time to be able to do our 3 month and 9 month data collection and also do the qualitative interviews and have some time at the end for data analysis and dissemination. So that's basically where we're at this time. Recruitment has gone very well. Of course, it's always a little bit slower than one would expect, but I think we'll be very close to reaching our enrollment targets. I'm hoping that we have about 25 people in each group who've received the intervention, and in our comparison group, I think is probably where we will get to, but we'll see what happens until the end of June. So I've included any references and some additional sources that I thought might be useful to you in this, and I'm probably went a little bit too long, but I'm very happy to respond to any questions or comments at this time.
Well, thank you so much, Dr. Weeks. And it was perfect timing. We're at 1:51. We have a couple questions that I would like to discuss with you. So let me just pull up. Okay, so the first question, of course, we all are more than aware of how important safety, ensuring that older women remain safe when we're trying to provide service. So the first question comes as are the information packages delivered in a discreet manner that will not cause further issues if the person is still living with the abuser?
Yeah, thank you. And we do have several participants who are still living with an abuser or still have a lot of involvement in many ways. So yeah, thank you. We had to think about a lot of these things. I would say that as a whole, it's very individualized. So basically, whatever we have an amazing research coordinator who basically does the communication with the new participants and makes sure that, we are doing things in a manner where she will be as safe as possible. A lot of them are electronic. So I know we have mailed some, but I think in most cases they have been shared electronically. So it's like a PDF attachment kind of thing. So yeah, if the person does want them mailed, I don't know if we've ever had to try to hide information about where they come from. They would be sent from the University of New Brunswick, so it would look like you're receiving a package of information from the university, essentially. But in general, it would just really be what do you want us to do? How do you want us to get that information to you? I know that there have been many cases where the first way the person contacts us isn't necessarily the way they want us to contact them in the future. So some of the women are using various types of emergency shelters and transition houses. So there may be a phone that they have access to but that's not the way they want us to contact them, later on. I could mention too that one thing we included in our budget, and I'm so glad that we did this, is that we anticipated people needing some financial assistance around access to technology or just simply costs incurred if they're using their own device. So we've been able to send people money to help compensate them for some of those things, especially like phone service usage, that sort of thing. But we've actually been able to provide a few of our partners with tablets so that if the woman wanted to participate virtually but did not have a device of her own that she could use. And we have, goodness, I don't know the exact number now, but I think it's at least five or six that we've been able to provide to our partners so that women that are using the services of that organization can use that device. So that's been really helpful. I do think there were some participants who wouldn't have been able to participate without having the resources to be able to do that.
I'm always happy when I hear when
Mhm.
programs really make it accessible,
Mhm.
especially for rural women that maybe
Mhm.
don't have access to Wi-Fi, or why we know in
Yeah.
Canada Wi-Fi costs are exorbitant. Okay, let's get through these questions. We're getting a lot of really
A
great
lot
questions.
of
Okay,
questions.
so next question. You're on the hot seat, Dr. Weeks.
Okay.
So how do you sign up to be a participant, and
Mm.
are you looking for more BIPOC participants?
Yes, definitely. So, I did include my email. That's a great way to contact me. So, it's on my last slide there. It's just lori dot weeks at dal.ca. So you're more than welcome to contact me if you know of anyone who's interested. Definitely, we're looking for more BIPOC participants in our sample. We want to have as diverse of a sample as we possibly can. So, yeah, if anyone is welcome to contact me, or I might think I included, did I include my phone number on that slide? I may have, or I may not have.
Oh, I see that somebody has nicely in the chat put your email in. So
Oh,
please
thank
refer
you.
to Lori's email. Your
Thank
next
you.
question, Lori, is hi, does the money given to the participants go to the organization or the individual?
Oh, thank you. You know what? I just realized as you said that, neglected to say that we also have an honorarium for study participants. So
Right.
any of the women who participate in the study receive an honorarium of $125. It's quite a long intervention, right? And that's one of the things I was always interested. So it's quite a lot of hours of time to participate, in the program, participate in the data collection. It's 3 times of data collection, the quantitative piece, then there can be another interview. So and then there's just initially the contact to sort of do the screening and informed consent. So it's quite a lot of time. So yeah, the women directly get $125, and that's a gift card to either a grocery store or a hardware store. So we have a few options. They can receive it either digitally or we can mail them a gift card. Again, we're trying to give as much choice as we can. But then that money that I did mention, that was directly to those organizations that are contributing resources and staff time to the project.
Oh,
Yeah.
that's wonderful to hear. Okay, next question. How does the project ensure that its advocacy intervention for older women experiencing IPV remains culturally sensitive and diverse, especially given the unique demographic compositions of the three maritime provinces,
Mhm.
Nova Scotia, New Brunswick, as well
Mhm.
as PEI?
Wow, that's a really good question.
It is a great
Um,
question.
let me think. What could I say specifically about this? Well, we do have a very strong advisory group. So, right from the development of the project to implementing it, we have representatives from each of the 3 provinces who have tons of experience working with older adults, working in domestic violence, know their communities really well. So, that's probably has helped a lot. Um, I would also say that we've been very carefully matching. So we have trained people. We specifically recruited facilitators in each of the three maritime provinces. So if you are a woman participating in Nova Scotia, not only will you have a facilitator in Nova Scotia, but someone from as close as possible to that region. So as you could probably imagine, we have one or two organizations we work with right in Halifax, but we also have several in more rural places as well.
Mhm.
So I think that and we have specifically a research assistant and a facilitator who are francophone in New Brunswick. Specifically, the facilitator is in the Acadian Peninsula. I'm not sure if that's helpful geographically for many of you who are joining from Ontario or other places, but kind of the northeast corner of New Brunswick is a very strongly Acadian area. So that's where a facilitator and so we're trying to match as best we can within, and you're right, there's very, even in small provinces, there's very different regions, traditions, even, you know, rural and urban. We don't have huge cities, but it's very different if you are living in Halifax versus living in Cape Breton. Those are very, very different contexts. So yeah, those are some of the things that we've been trying to pay attention to.
Okay, two more questions, and we have 2 minutes to answer them. So, first
Okay.
question, average age of the participant, as
Yeah.
well as um, were some of us were surprised of the age
Yeah.
being in the 40s because that
Yeah.
means, a lot of us that don't consider ourselves as
Mhm.
older women could be a
Mhm.
part of the project. So maybe if you could speak to average age of the participant and the low age range.
Yeah, thank you for that question. I could just talk the whole hour about
Mhm.
issues around age. I'm a gerontologist and I'm 54 years old, so I obviously can be a participant in this study. So the literature on this topic is fascinating, and a lot of studies they, start at age 50 or in their 40s. That's a really weird, large number of years to include.
Mhm.
There's many different generations and cohorts when you say 50 plus or 45 plus. Actually, a systematic review project I'm leading right now, we're only going to look at evidence from women 65 plus because I think that that's a real gap. We probably know more about younger women. Um, so it's this sort of distinct, trying to sort of argue that it's different than a focus on younger women who often, in addition to age, often are caring for young children as sort of a qualitatively different group of women who are at least in midlife and older. So that's kind of the main distinction we're making. But again, truly recognizing that it's a huge group of people. Um, in terms of demographics, I'm trying to think, our research coordinator shared that with us recently, although we've had quite a lot of new participants coming in lately. So let me think. I think we had the majority were under 60, which is interesting, isn't it?
Mhm.
I think at that time, if I remember correctly, it was maybe 20% were over 60 and the
Mhm.
rest were under 60. So it's very much a study about midlife in a lot of ways. So depending in the end what the ages are and the breakdown, that'll affect kind of how we talk about the results and the implications and the recommendations of the study. So yeah, thank you so much for that question about age. It's a very important one. Many times it's very tricky to write about this because a lot of times, what age do people think of themselves as older? There's no magical age there, right?
Mhm.
Yeah.
Very interesting. And
Mm.
when we're looking at 45 plus, you're
Mhm.
looking at gamut of
Mhm.
potentially over 50 years.
Yes.
Considering
Mhm.
I'm aiming to live to 110, so you're looking at 60 years.
Mhm.
Okay, Dr. Weeks, we have run out of time. I want to tie in this wonderful comment that I kept reading in the chat box. And I think it nicely closes out the fact that all week we've been recognizing Victims and Survivors of Crime Week here in Ontario
Mhm.
and throughout Canada. One comment in the chat says, this project is deep and will go a long way to help older women or midlife women. Great research work. Kudos to Dr. Weeks. So I'm going to end off there. I want to thank everyone very much for attending. Please check out our website for our upcoming webinars, for any of our contact information, and of course, the recording of this webinar. Thank you, everyone, for attending. Dr. Weeks, thank you so much. Have a good
You're
day.
very welcome. Thank you for
Bye.
inviting me. Thank you.
Anytime. Take